Good morning, everyone. Welcome back to Sun Up on 7. It's an exciting Wednesday. I hope that you enjoyed that conversation with Janelle Chandona, recently appointed 13th Senator representing the NGO community. And we want to resonate a message that she put out there. We want to give a big thanks to the NGO community for all the work and the contribution that you make to the development of our country. And there's definitely something to look forward to, and her being on that seat. And of course, let's look forward to all that goodness that comes up from that. And Wednesdays is Wellness Wednesdays here on Sun Up on 7. So we're going to jump into that conversation, talking about tuberculosis, what tuberculosis is, what are the challenges of addressing tuberculosis in the country, and of course, what is the Ministry of Health doing? So with us on our couch, we have representatives from the Ministry of Health. We have Ms. Ravenna Polanco, Adherence Councilor at the CHES Clinic. And we also have Dr. Marvin, who is also diagnosing and treating persons with tuberculosis. Right, so good morning, Ravenna. Good morning, Dr. Marvin.
Hey,
how are you feeling today?
Very good.
Good. Rav, how are you feeling?
Surprisingly, okay.
Yes. I call her Rav because, I mean, I got to share something. So Ravenna and I, we worked for 3 years at the CHES Clinic, doing adherence counseling work, supporting persons who are living with HIV, who are also living with tuberculosis. So I've been telling her for a while that she needs to come on the show.
So you finally got her.
Yes, and I mean, you could have told when they told me that she's going to be here.
Yeah,
right?
the excitement. You know,
Yes.
like, the little kids were ready for school or you get a lollipop or so. He was like out of this world. So he's
I've
super
seen
happy.
Yes. So it's so good to have you here with us. So let's get going, right?
So yeah, let's start the conversation. And Janelle made me laugh because she's like, who says tuberculosis is exciting? No, it's a necessary and exciting conversation because it's about health. It's about taking care of ourselves, understanding what tuberculosis is. Because people hear it all the time, but some people might not even know what tuberculosis is. So if we could start off right there and just give a definition of what tuberculosis is. Dr. Marvin, I think this one would be very fitting for you.
Okay, if you insist. Tuberculosis is a contagious infectious disease caused by the bacteria, Mycobacterium tuberculosis. It's spread from person to person by the air droplets, which we produce whenever they cough. Basically the same transmission as COVID, right? And whenever someone would pick up the droplets, they would get infected with TB. However, these persons may not be symptomatic. For them to be symptomatic, it's usually some problem with their immune system or something like that, and they would go on to develop TB disease. And that is where we see all the symptoms and whatnot.
And so what are the symptoms?
For TB, the main symptoms would be a persistent cough, a cough lasting more than 14 days, night sweats, unexplained weight loss, coughing up blood, loss of appetite, anorexia, any of that stuff that would, give us a red flag to say, hey, this person, we need to do a workup for TB.
Most definitely.
Yeah.
And so I want to bring Miss Ravenna into it because I can't call her Rav because we're not the panel level. We're not spin marble behind the block, so I'll be nice. Ravenna. Miss Ravenna, it's so nice to have you here. And as being a counselor, talking to people, hearing their stories, what can you say the community needs? When you are talking to people, what has been some of the support, the needs, the wants from people when they have TB?
I think basically what they need is the acceptance from either their relative, the community. We don't go around asking for a disease, asking for an infection. So we have to always put ourselves in that shoe to know, imagine how this person is feeling. He's not well, probably he's not receiving the adequate food. He doesn't have adequate financial assistance, all of those things. And at that time, they need all of this support, especially from the family, because we're there as a counselor, we're there as a doctor, as a pharmacist, as a lab technician. But they need more of love and care from their family. Basically, everyone asks for that. And we see great recovery from those that have family support. So I think that plays a huge role in them getting better.
So you would say that's one of the biggest struggles, that sometimes it's not family support that they would be receiving?
And also what we notice is the finance, because, sometimes they refuse to come for medication because they don't have an adequate food to put in that stomach. And, we have this mentality that, well, of course, and we have to have a good meal before taking our medication, and that's really, sometimes, most of the time, it's financial.
So,
But with the Ministry of Health, what we see, the treatment is free, basically. The screening is free, and the follow-up testing. So that's really nice for them to know that, because simply an X-ray costs might be a thing for them to worry about, and having it available for free give them a sense of relief in that sense.
Definitely. Peace of mind to know at least that is covered. So all I have to worry about is more medication-wise and, you know, quality of meals, because you have to take care of yourself. You have to take care of your body.
yeah. Ravenna, I want to ask you, so you're saying that one of the biggest challenges is getting that support. And I am assuming that the big issue is the discrimination that people with tuberculosis would face. Right. So in your role, what are you doing, or what is the Ministry of Health doing to address that discrimination and enhance that support system for persons with tuberculosis?
Basically, individually, we do a lot of health education for them to understand that, you know, we can prevent this, and it's something that's curable. We also want them to know that if you take proper treatment, you will survive. If you came in contact prior to him or her being diagnosed, you have also treatment for the latent TB infection, and these are free, like I said. And also, we want to keep in mind that these people are there, you know, struggling, don't know what to think, how I got it, when I got it, what did I do wrong, all of those things causing emotional burden on them. So
definitely.
Yeah.
So it's important to build that awareness of what tuberculosis
Understanding.
is. Having understanding, that's how you rightly mentioned, that nobody goes around saying, I
I
want
want TB. Like, you're giving it out.
Can
I get one?
in the air, and you inhale it, and you can get infected with it. Right? It was really important that you mentioned that treatment is available even if you're asymptomatic or you're symptomatic. And both of them, again, treatment is there and is cured. So
it's a curable disease.
Exactly. So there's no need for you to feel, oh my gosh, I'm going to die from this. No. Dr. Marvin, I want to ask you, one of the things that I was reading from the World Health Organization is that COVID affected very much the diagnosis and people accessing treatment. In your view, working in the medical scene, how has it been, COVID and diagnosing and treating people for tuberculosis?
All right. Well, considering both are diseases of the respiratory tract, both of them have, you know, some of the same symptoms. They have cough, they have fever. I would say in COVID, everything was all over the place when it came to, everything was COVID,
right,
basically. So we weren't doing much screening for TB. So we're looking to start that back again, you know, specifically within this week. But even as practitioners, you know, we see people with cough and fever. The first thing we go to is COVID. And I think TB has been a forgotten differential diagnosis for us. So now we're going back, you know, looking more completely at our patients and, you know, trying to make an adequate diagnosis and screen people for TB once more.
Yeah, definitely.
And so tomorrow, the 24th, is World Tuberculosis Day. I'm sure a lot of people are like, what? There's a day for it? Yes, there's a day. Could you tell us, before we even get into the activities, why do you think it's necessary to even have a day called World Tuberculosis Day? What's the importance of that? And so, Dr. Marvin looked at you, so... Ravenna, this is you.
Okay. It's important because, you know, TB hasn't been eradicated. TB does exist in the community, and sometimes there are people that smoke and would say, oh, I simply have a smoker's cough, sorry. And then, you know, but when they're tested and when they go losing this weight, feeling fatigue, spitting up blood, having this consistent fever, then they're screened and boom, it's tuberculosis. And you know, when it comes to tuberculosis, I also want to mention that doctors involve adherence counselors, but it involves a whole heap of people behind this. We have the community health workers who support us in the villages. They have done an excellent work, the ones that we've worked with. And it entails a lot more than we are seeing. And the work is a lot also. Probably you might not know, but we have been going to to different organizations that invite us to do health education, screening, especially because in talking about tuberculosis, we say, oh, it's located in the ear. We have a perfect environment here where, I see everything like barely windows. And,
It's enclosed,
if somebody comes in with TB, we need to learn to ventilate our areas.
Right.
And,
I'll put
at
on my
least
mask.
once
So in that regard, can you tell us what are some prevention measures for COVID now, for TB?
Where you get COVID from?
Yeah.
Doctor, you're one. No.
He's like, I'm
I know. It's like I can take that one.
Well, for prevention methods, something that is really underrated is the mask. The mask,
helps you not just for COVID, but also TB, right?
Yeah, very,
the
very
mask.
much. The ventilation of spaces, right? Adequate ventilation, cannot stress that enough, because the more contact you have with someone in a not well ventilated area, the more bacteria gets in the air, the higher probability of you getting it. And also something that could be improved, I'll also say, is self-care, because when it comes to your immune system, that is what determines if you're going to go from that asymptomatic TB to the symptomatic TB, right? So adequate self-care, eating healthy, exercise, stuff like that to keep your immune system intact.
Definitely. And I'm assuming completing your treatment too, because if you get cured, then you cannot transmit it to anybody else, right?
Exactly.
So
That's the goal.
that's the goal.
Well,
That's the goal.
really, you can't transmit, even before you get cured, you're no longer able to transmit, I think, after 2 months?
After 1 month.
After 1 month?
2 weeks to 1 month.
2 weeks to 1 month after you have started treatment, you're no longer able to transmit. And those with asymptomatic TB cannot transmit it. So you just have the bacteria in your body, but you're not able to transmit the
and you can
infection.
live
Yeah.
asymptomatically,
Yeah,
right?
well, a lot of people, many people are infected with TB. They just don't know it yet because, they're asymptomatic.
Right.
Oh, wow.
Yes.
So
A
you
lot.
can have it and you don't know.
Yes, for this reason, we have things like the health fair in which we're doing screening. So we would test you to see if you have the bacteria in your body. We just would do what we call the Mantoux test. We just inject protein in your arm, and within about 2 to 3 days, we see if you get a swelling on the arm or whatever, and that will determine if you have the bacteria in your body.
So tomorrow, you're going to
Yep.
be getting these free because I said,
It's
Lord,
not just tomorrow. It's this happens every day. You could go to chest clinic and you could get this all the time, but tomorrow
it's going to be at Battlefield Park
That's
tomorrow.
right,
So,
yep.
But every day. So
Every
every
day.
single day, these are free.
I don't know about Sunday, but
They will call up and say, Doc, you say every single day now. They call your whole Sunday.
Ravina, you need to show up today.
Yes,
It's
exactly.
from Monday to Friday, excluding Thursdays, because it has to be read 2 to 3 days after, and we do not work weekends, right? So it's done Monday, Tuesday, Wednesday, Friday.
Yeah.
Okay,
Yeah.
okay.
Yeah. So there's the
There's access, there's availability.
yeah,
People can go
there's
out
the
and
health
get.
fair tomorrow at Battlefield Park. Can you share with our viewers where is the chest clinic so they can go and get checked up?
The chest clinic is located at Cleopatra White Compound, and there's a 2-floor building at the back. It's named Chest Clinic, and you just go there and you talk to the nurse. She'll evaluate if you need screening or had to be evaluated by the doctor before, and then we follow from there. And it's an easy process. It doesn't take long, and we try to work with you as much to guide you for us not to lose you before we know a diagnosis. So that's really important. In regards to the medication, I think we have come a long way because first we had people taking 12 to 15 tablets, and right now we have a fixed dose. We have exactly a fixed dose combination with the 4 antibiotic being in the tablet, but you can take up to 5 tablets. So that's
Still not
but
12.
that goes according to your weight, and to me it's less of it doesn't cause as much side effect. So that's why there's also the direct observation therapy, which we are in charge as adherence counselors who are throughout the country of Belize. I think in every district we have one. And Belize is the only place that has a chest clinic. The others are being done or followed up by a public health nurse in the districts. So if you don't go looking for a chest clinic in the districts, go ask for a public health nurse at the clinics or hospitals so that you can be evaluated properly.
Thank you for that clarity.
Mentioning it to the doctor, because you're the best person to tell the doctor what you're going through. Because if you tell him, oh, I have cough today, and it was like 2 years ago you're having this cough, then because some people have cough for like 2 years, and they would say, I think it just started. So, and then they don't notice until they start falling the weight loss. Why am I losing so much weight? And so forth.
The weight not sound so bad at sometimes, you know. I just want to throw that out.
Can you imagine that chronic cough? Then
Yeah, that's the one where just like, that's the only thing where you're selling for TV, that's the weight loss. Anyways, but with that, let's not lose weight for random reasons. Let's not be coughing up blood. Let's nothing in general, guys. Come on now, wear your mask and go out and get your free testing. Tomorrow at Battlefield Park, they're gonna be a range of different testing, but it's not only then. You can go Monday, Tuesday, Wednesday, except Thursday and Friday, and go out and see what your status is. Kevin and I like to say, know your status. It takes away a lot of pressure and stress of not knowing what's happening with your body.
And I think what's also important that if you, after hearing this conversation, if you know somebody that has these symptoms, please let them know that they can go to the chest clinic and get screened as well. You know, that support system is very important. So thank you.
It's free.
Yeah, and it's free.
They're not like, oh, you have to pay a lot of money for this, guys. Come on now. No, like free thing.
Things hard.
Things hard out there, But thank you so much, Dr. Marvin, for being here. Thank you so much, Ravenna, for being here. We truly appreciate your time. And we're going to have a lot of people go and get all that free testing and everything for you. And might have to make your work on Sundays. So, so we will go to our next commercial break. And when we're back, we're going to be talking about fire management. So stay tuned for that hot conversation. We'll be right back.